drugs to treat neovascular macular degeneration with, bevacizumab or Avastin, ranibizumab or Lucentis, aflibercept or Eylea. And so for wet macular degeneration, a lot of people feel that the three drugs are probably pretty interchangeable. There's a general impression in our field that aflibercept lasts a little bit longer than ranibizumab. And a lot of that comes from the VIEW studies, which were the studies that got aflibercept FDA approved. And basically, those compared Q8-week, every 8-week dosing of aflibercept after 3 monthly loading doses with monthly ranibizumab and found that they were fairly equivalent in their outcomes at 2 years. And so because of that longer treatment interval, it was felt that the drug may work longer, last longer, and pharmacologically it seems that way as well. And after aflibercept became available, there are actually a lot of switch studies that have been published, but all of them are looking at switching from bevacizumab to Eylea or from ranibizumab to Eylea or aflibercept. And there actually are no studies that are looking at switching from aflibercept to another drug, such as ranibizumab. Last year, there was an uptick in severe steroid inflammatory cases after Eylea injections, after aflibercept injections. And it led to a voluntary recall by the manufacturer of Eylea. In our group, we saw a fair number of these cases, actually, of these steroid inflammatory reactions. And a lot of the doctors in our practice made the decision to switch over to ranibizumab instead of aflibercept. And so it gave us this chance to look at, well, what happened to the eyes that weren't switched because they were doing poorly on aflibercept, but just across the board, just switched over. And so we had a chance to delve into that. And what we found was that patients that were on a fairly regular interval dosing of aflibercept and then switched to similar intervals, if not shorter intervals, of ranibizumab actually did worse. And we looked at the first 3 visits after they were switched and found a significant worsening in the central foveal thickness from about 182 microns at the switch visit to about 190, I think it was 199 microns afterwards. And that was significant, even though it's a small increase in the central foveal thickness. It was significant because 60% of the eyes got worse essentially after we switched over to ranibizumab. The interesting thing when we looked at the intervals, because we required the patients to have the same intervals between injections before the switch and after the switch, but after the switch they could be a little bit shorter as long as they weren't longer. And we found that even though a lot of doctors actually preemptively shortened the interval after the switch because they kind of like, it's not going to last quite as long as Eylea, so let me shorten the interval a little bit. Even despite that, we saw this worsening in the macular edema and a subsequent worsening in the visual acuity as well. Again, not a huge difference, but about a 20/50 to 20/60 drop in vision. And clinically, when we talked to a lot of the doctors in our group that did this switch, including myself, we saw that as well, where a lot of patients would come back that first visit after being switched to ranibizumab saying, I'm not seeing as well, this drug is not working as well for me. And as a result, eventually a lot of these patients did get switched back to aflibercept. But some doctors were very, very concerned and scared to go back to that drug because of the inflammatory issues, and so kept them on the ranibizumab.